Hello guys, my name is Anita Luanga. I'm an exercise physiologist, internist, and geriatrician. Today I'm going to be talking about deep vein thrombosis and pulmonary emboli. I'm going to break these topics up into two separate videos, so if you're interested, stay tuned in for the next video. You might be asking yourself, what is deep vein thrombosis? Deep vein thrombosis is a situation where a clot forms in one of the blood vessels in the arms or the legs. Deep vein thrombosis can be caused by many things. For example, trauma. Say if your leg is hit by, say, when you're in a car accident or if you're playing sports, the blood in that area might decide to clot because there's trauma to the blood vessel. Another situation where somebody can develop deep vein thrombosis is if they have not been moving around enough. For example, if they're traveling on an airplane and they're sitting for a long period of time, their circulation is not as good as it should be. The last situation where an individual can get deep vein thrombosis is when they have malignancy that we do not know about. Unfortunately, when we have a malignancy going on, the cancer can secrete certain hormones that makes the blood thicker, in simple terms, thicker than it should be, and this can cause a clot or deep vein thrombosis. You might be wondering, so what? What are the complications of having a deep vein thrombosis? Why do we care? The problem is when somebody has deep vein thrombosis, if the clot gets big enough, it can actually cut off the circulation in the limb and can make it difficult for the body to function the way it should. And in some cases, individuals might have to have amputation if it gets very bad or it's not caught early enough. This is very rare, but this is one of the things that we worry about. Another situation that can occur is that the clot can travel from the limb, usually the leg, and go into the lungs. If the clot in the lung gets big enough, it can actually cause cardiac arrest and death. This is very rare, but this is something that we worry about. So your next question might be, how can we prevent that? How is deep vein thrombosis treated? In general, deep vein thrombosis is treated with blood thinners. The duration with which you will take the blood thinners depends on the cause of the deep vein thrombosis. So if you do have deep vein thrombosis, your doctor will ask many questions and they may do additional tests to help them figure out the cause. Based on that, they can determine how long you need to be on the blood thinner. They might also do a scan of the chest to make sure the clot has not traveled to the lungs. If the clot travels to the lungs, that is called pulmonary emboli. In the next video, I'm going to talk about pulmonary emboli. Bye-bye for now.